Welcome back, everyone, to Misconceptions. This is going to be a special edition part 2 with Malka. Thank you for agreeing to help us hear the end of the story. I think we kind of left people, kind of on a cliffhanger going, you don't even know what
Yeah,
happens next. And thank you for saying yes to continue. How are you?
sure. I'm doing well. Always happy to be
Okay.
here talking to you.
Terrific. So
Mhm,
we're going to pick up from the last part of our conversation was when you began to really
mhm.
consider a different approach, a not as straightforward medical
Right.
approach, more holistic, perhaps a little bit.
Mhm.
Maybe can I call it on the fringe of medical science? Tell me a little
You
bit
can.
about. I know you're like, no, we're not calling it fringy,
No, it's
but
okay. I think medicine evolves, and the more people that try something new and the more data and research that come out of it, you know, things start to fit. Scientists and doctors start to figure things out, but obviously the people that are the pioneers are sometimes looked at as like, is this ethical? Is this something that, is it really going to help? But people like me who've been through so much and really feel like they're at a dead end, you have to make a choice. You have to decide, is this something that we're willing to try, even though we don't know how efficacious it is? Or do we throw our hands up and say, okay, like we're moving to surrogacy, we're moving to adoption, or maybe we're going to live child free, So what had happened was, is with the multiple, with the recurrent pregnancy loss, I'd heard through the grapevine, mostly through Facebook groups, and the Facebook groups can be a rabbit hole, but they can also be a real source of information. So just, take that information and do what you want with it. So through a Facebook group, we had heard a lot about reproductive immunology, which was something I had never heard of before. The basic premise is that some women's bodies almost have like um, an immunological issue in pregnancy. It's not really present necessarily outside of pregnancy, but their bodies reject the pregnancy. Their bodies see, which, in general, we know that pregnancies are a foreign um, body to our bodies, and it's a miracle that all bodies don't reject pregnancies. So it's just our immune system's a little bit more overactive, and it's just an approach to try to reduce the immune response and hopefully maintain a pregnancy. So we had met with a doctor close to DC, and tried to start that process with her. um, there were a lot of hiccups along the way. And to make a long story short, we did two transfers with her that were unsuccessful, even with this immune treatment. And so that brought us to around April time in 2020. So, of course, everything crazy in
Mhm.
2020 was going on. Or, excuse me, this was 2021. We did the whole process through 2020. So that was just an adventure of its own. And then at that point, I said to my husband, like, I'm done. I can't keep doing this. I can't keep putting my body through this. It's so draining. And he said to me, well, we didn't really see the the top immunologist, this doctor that we met with. She dabbles in immunology, but she's not really truly a reproductive immunologist. And so he just felt that we needed to give it like one last try with the top doctor, who basically studied with Dr. Alan Beer, who is the father of reproductive immunology, started in the 80s. And this doctor was Dr. Joanne Kwak Kim in Chicago. But her wait list was 6 months long. And so I said, okay, how about we'll get on the wait list, but I also need to do something else in the meantime. I can't just sit here. Let's start looking at the surrogacy options. Let's start looking at the agencies. Let's find out what we're comfortable with. Let's learn about it because there's so much to learn. And let's get that process moving.
Before you
So,
before you continue, I do want to I want to interrupt because I think I have to address this question of like what is reproductive immunology from like
sure.
a kind of from like the mainstream view, and then also like you said the alternative view. And I think that
Mhm.
you highlight from a mental health perspective and from a physical health perspective, it can really feel like I have no other options. And this is what I hear from the women I work with and the couples I work with is this idea of like,
Mhm.
what choice do we have? right? Like if you keep telling me just do it again and again and again, the same way we've been doing it, and I have loss after loss after loss, how dare you ask of me to do this again and again without recognizing the repercussions emotionally, right? So there's no question that there is this sense of, I'm going to use the word desperation, but also practicality of like, don't ask me to do the same thing again and again and hope that I'll get a different result. On the flip side of
Right.
that, or on the continuum of that, right? One of the things we know about the population of people working with the population of those struggling with infertility is the desperation. And with
Mhm.
desperation is tremendous vulnerability, right? The
Right.
vulnerability of people that can be taken advantage of, who can be sold elixirs and snake oils that are, anything
Yes.
possible, right? Anything, anything,
Yes.
anything to have my
Mhm.
baby. And I get that. I hear that.
Mhm.
I honor that and respect that. And I think most of us in this field really do. And then we also feel very protective of our clients, right? We are so
Mhm.
protective of our patients. Like, I don't feel safe with certain things that you're doing because they're not evidence based, they're not science based. And then we have the outcome that we prayed for. And we're like, oh, shoot, what do we do with this information now? Right. Like, that's the bottom line.
Right.
Um,
Yeah.
and I think that a lot of this comes down to informed consent. Like even when we talk
Mhm.
about a reproductive immunologist, there's no board certification in reproductive immunology that I know of at this time. There's also no board certification for reproductive psychiatry. And I would refer to anyone who identifies as that and has training in it. So it's like,
Mhm.
I think we would call them emerging medical science.
Mhm.
American Society of Reproductive Medicine, as of last year, still came out with saying like emerging. We don't have enough evidence that it's effective because we've done, those that did it and those that didn't, and the results seem to be pretty close or fairly similar. And so
Right.
I just think that's important because if anybody's listening to the podcast is like, how come nobody ever told us about this? How come we didn't do this? I want us to be very clear that it's a very narrow field right now, incredibly narrow. Beer is basically the only one who's doing it with his, the people that he works with. And that all for me, that raises an area of concern. And so if anybody is exploring this, like please consult with your medical professionals, your doctors, your board certified reproductive endocrinologists who can kind of guide you on what the actual data shows. And that's doesn't mean that you won't still want to do it. And I understand that.
Yeah. And I think we have different perspectives also because, you know, you and I are in different positions. And so as the patient, as an educated patient, um, and also a desperate patient, I felt like the research that they've done so far supported it somewhat, right? Like we can't say
Sure.
it absolutely points to success because that's
Right.
just not the case. But also doing studies on pregnant women and doing studies on pregnant women with recurrent pregnancy loss is just such a hard field to advance because of the ethics involved.
Yeah.
So we really just have a lot of case studies, and that just makes it also really hard to push forward. And so, yes, I would absolutely say you need to go into it with informed consent, understanding that this is not going to necessarily change your outcome. It is just another avenue to explore when you've kind of explored everything else and it hasn't worked.
Exactly.
Um,
Exactly.
and that's just how, I think if my husband hadn't been so gung ho about continuing, we would have just continued with surrogacy, and that comes with a whole set of um acceptances too, right? Like it's not, people might just say like, well, why didn't you just do this, 2 years ago? But it's every step of the way is a certain mourning process. Um, Not being able to carry your own child is something that most women don't have to think about. And so that was something that was really important to me and something that I really, really wanted. Um, and just towards the end of our journey, I think I was ready to accept it more than my husband, who wouldn't have been carrying our child anyway. But I think from his perspective, this was still going to be less expensive than a surrogate and less complicated with all the relationships and what all that entails. So anyway, should I continue with the
Yes,
okay.
please do. I appreciate the
So
conversation.
No, and I think that you bring up a very excellent point, and I think it's a tough subject, and you can debate it all day. I've talked to my Ari about it so many times, and it's just it is what it is, and you have to just I think being aware and understanding is the most important. But yeah, we are a vulnerable group.
Right.
So in the summer of 2022, I am getting all my dates mixed up. No. Summer 2021. Okay. Summer 2021, we made the appointment with Dr. Quack Kim in Chicago. It was a 6-month wait. So we made the appointment in June and we could be seen in December. In the meantime, we started interviewing with surrogacy agencies and we actually matched with a surrogacy agency, not the surrogate itself, but the agency. We found one that we liked. We spoke to a lot of people who did surrogacy journeys. We spoke to a couple of agencies and talked with them and learned about their approach. And it's really hard because there are so many, and they're all a little different and they all cost a little bit different amounts. And what we really ended up going by was people who had used the surrogacy agency that liked it, and just the feel that we got for the people who we spoke with. Warmth is such an important thing when you're going through something that is so difficult and emotional. So we found an agency, and actually pretty quickly they were able to match us, which is not always the case. Some people have to wait a year or so, but we had a lot of factors that helped us. We were a young couple. We were we didn't have any children, so those were things that really like helped us bump up the list and find somebody quicker, because some surrogates have certain requirements that they only want to carry for somebody who hasn't had a child yet and things like that. So we found a lovely surrogate. She happened to be an hour from where we lived, which is also insane because some people can travel across the country. And so it was amazing because she was going to be able to come to our clinic and we were going to be able to meet her and see her frequently and go to different scans and stuff together. So the first part obviously is getting your surrogate medically cleared. And so after we matched with her and we clicked with her and we met her husband also via video, she came down to our clinic and went through the medical clearance process. And this was around August, September 2021. And so she did the initial medical screening, everything looked good. And then they wanted to do a mock cycle, which is essentially where they do a fake cycle as if they were going to transfer an embryo, but obviously at the end they don't do it. They just want to see that everything lines up the way that it should. And unfortunately, that did not go smoothly. Her lining just wasn't building up the way that they would expect. And because she was a surrogate, the doctors are very picky because they know how much time and money and energy you're investing into this process. And so my doctor was willing to give her one more try to see if a new cycle would work. But after that, she kind of was going to say no. And unfortunately, the second cycle that we tried ended the same way. And it was so tragic because everything else just was amazing. We felt so lucky. She was our age. She had such great energy, such great support, and she was so close. And so that was a really big letdown, because after you get to this point of, okay, I'm accepting that I'm doing surrogacy. Okay, like it might take a while, but we're gonna do it. And then you match with somebody, and then you don't think that anything else can go wrong, right? Like you're not using your uterus anymore. You're not using your own body. Um, and so it was extremely depressing, to say the least, that it wasn't going to work out with her. And we kind of felt like we were back at square one. And so the next couple months, we really just I was trying to find people on my own. I was asking all my coworkers if they knew of anyone that wanted to be a surrogate. It's kind of like when you are wanting to adopt, like they say, get the word out there. Sorry, my throat. And I couldn't, we had a lot of false leads, you know, people that we thought might be a good candidate, but then, you know, if they have any kind of blip in their birthing history, it's a no. So it needs to be completely squeaky clean, you know, maybe a C-section or two, but not multiple C-sections. No hypertension in pregnancy, no preterm birth, things like that. So it was just a hard few months of just trying to find somebody and not really succeeding. Um, and so then comes December, and our appointment to Chicago is coming up. And we had booked our tickets. We were committing to going to see Dr. Kwak Kim. One last shot. Here we go. And I said to my husband, you know, I I haven't gotten my period in 8 weeks. And for me, that was sort of normal, because I always had an irregular period. But it had never quite been that long. And so I said, you know, we're going this week to Chicago. Let me just take a pregnancy test, just make sure we're all good, baseline. And wouldn't you know, it was positive. And I can't, I took another test and it was positive again.
Mm.
And I'll say a few things. Number one, um, people think that that's the end of the story, right? People think like, okay, you got your positive, it happened naturally. Like, it's not, because I had had a natural pregnancy once before, also spontaneous, and it ended at 4 weeks. So I was not really thrilled because I felt like here's another pregnancy we didn't have any preparation for. We're gonna miscarry, and not only that, but we're like ruining our chances when we go to Chicago to have a baseline appointment, because now my hormones are all over the place and who knows what's going on in my body. And um, my husband really felt the same way. We didn't know whether to celebrate. We didn't know kind of how to feel. We just were kind of numb in a way. And so that was on a Sunday, and my appointment was on a Wednesday. So I was able to get in with my reproductive endocrinologist the next day for a blood test, and they confirmed I was pregnant. I was my beta blood test results came back that I was about 5 weeks. Um, at that time, I played doctor myself, and I just took all the medications that I thought I needed to take that I had in my home pharmacy. Not recommended, but you know, you do you. Um, and also, I had a really good friend. I have a really good friend who's excellently scientific and so knowledgeable and has been through her own journey. And she was also consulting with me. And the two of us came up with my own protocol until I could go see Dr. Krakem, because they would not make any recommendations until they saw me. So on Tuesday, we flew up to Chicago. We saw some friends, had a little fancy Chicago dinner. And then on Wednesday, we went and they did the ultrasound. The ultrasound matched the beta results that we had had. There was a tiny little gestational sac with a tiny little yolk sac and no heartbeat, which for me was so ubiquitous at this point. Like every single time that I had an ultrasound, I would see a very similar thing. And I
Right.
said to the nurse doing the ultrasound, I said, it's not, there's not going to be a heartbeat next week. There's not, you know, like I've been here before. I've been here several times. This is my 10th pregnancy. There's not going to be a heartbeat next week. And she said, I know that's how you feel, but just give us a chance. Give us a chance. You know, Dr. Kwek Kim, she really, this is her specialty. And I wanted to believe her, but I just felt like I couldn't. So we, you know, we went through the whole process there. You meet with a physician's assistant, they do a ton of blood work, they do ultrasounds. You spend the whole day there for a whole workup, and then they come up with a protocol for you. But because I was pregnant, the protocol was a little bit different. Um, and we kind of just had to wing it. And that's pretty much what happened. We went home the following week. I was seen at my clinic, And I brought my husband with me because I just knew I could not handle bad news by myself again. And they did the ultrasound, and unbelievably, there was a flicker. And the PA who was doing the ultrasound, I think she was excited for us because she gets excited when her patients have positive pregnancy scans, but she didn't really know us so well. And I don't think she understood the magnitude of that little flicker and what it meant to us. And I actually have a video of that moment. My husband took a video, and you hear me in the background saying, like, please tell me it's strong, please tell me it's good, please tell me, like I'm like praying and saying these affirmations almost to myself because I just so badly prayed for this and wanted this for so long, and I really didn't believe that it could happen. Um, and so fast forward, we continued to have positive, wonderful scans. Um, I had scans almost every single week because I needed to, and my OB and my reproductive endocrinologist and my reproductive immunologist, my whole team all agreed. And so between my perinatologist, my maternal fetal medicine doctor, the high risk OB, and my regular OB, I was seen every week um, until about 25 weeks. And then I was admitted to the hospital because I had placenta previa, which is a
We
whole
can't do
other
this
can of
simple, right? We can't do this
no,
simple. We got to do this
no,
complicated.
no.
Oh boy.
And I feel like I'm glossing over the pregnancy a little bit, but I couldn't relax. I couldn't enjoy it the way I think women who get pregnant at one time and have a healthy baby enjoy it. Pregnancy after loss is so scary and filled with nerves and worries. And I couldn't breathe a sigh of relief until my daughter came into the world and I heard her cry. And even then, she was in the NICU for a month. Um, but thank God she really did so well. She was born at 33 weeks and 1 day. Um, and she changed our life. She really did. And I don't I don't want my story to be a story where people say, "Oh, did you hear about Malka? Did you hear about her story? See, this could happen to you." Because honestly, I heard those stories when I was going through infertility and loss, and it didn't help because these stories don't happen to everyone. And you know, we can say we think it might have been the immunological um, intervention that helped support the pregnancy, and it very well could be. Or it could have just been a conglomerate of other
Sure.
factors, and we just don't know. Um, and I forever feel so fortunate and so lucky. But I do wonder, like, is this something that we're going to be able to replicate? I don't know. I
Well, I
don't
guess
know.
I want to ask you that question. Like, I was recently working with somebody who, also after many losses and just gave birth to a healthy full-term baby, a miracle. Like, I feel like a bubby, I have to tell you. Part of that, part of that experience is also knowing that there's no way she's going to do anything other than that protocol again next time, right?
Right.
Like, how could someone say, well, next time we'll just try without the additional protocol? And hers was also, hers was more of like an inflammatory protocol,
Mhm.
based on, and which is also really fascinating, this kind of, I think immunology, inflammatory, they're kind of bulked into the same conversation in terms of
Yeah.
an alternative approach.
Mhm.
But especially if we know, like, as Ashkenazic Jews, how prevalent these kind of issues are for us, things like, Crohn's and celiac, and we got to
Yes.
wonder how that's impacting pregnancy. But my question to you is
Mhm.
not what now, because that's always your private decision, but
Yeah.
how do you make a decision about, like you said, like, what do we do next? Like, do we have to go down that same route? Does that feel daunting? What are your thoughts about how you continue this part of the story?
Yeah, I mean, my daughter is 20 months now, so it's not like she was just born. And we are starting to think about that again. And it is daunting. I think I would have immediately said we would just go into surrogacy because of everything that we've been through. Um, but I will say that having the feeling of a child kicking in your uterus is the most unbelievable. I mean, like I can't even give it words. Unbelievable, amazing,
Sure.
um, all these cliche words, but it's just it's indescribable. And to be able to have that again, I felt like every time I worried, I would just put my hands on my stomach, and sometimes there'd be a little kick, and I'd say, "You're with me. We're getting through this. We're gonna make it." Um, it's such a gift, and I feel like I need to try again because that's a gift I'm not really willing to give up on, knowing what it feels like and knowing that I've done it. Um,
Yeah.
I don't know how many more losses I can go through. I think that's something that is really devastating. And I think my husband and I, we've talked about it, and I think our goal is to try again, see what happens. But knowing that surrogacy is there if we want and if we need it. And again, I feel so fortunate that that's even a consideration, because I know for a lot of people that's not an option. And and I know for a lot of people this the type of treatment that I had was not an option. And at every step of the way, I would say to my therapist, like, but I'm so grateful because I can do this. And she'd say, it's okay to be grateful, but to also say, like, this sucks and it's not
Yeah.
fair, you
Yeah.
know? And so yeah, it's an interesting place to be in. Quickly, when I was in the hospital with my placenta previa, the nurses would always come in and say, "You're just so happy. Like, you're so happy. We've had women in here who are miserable. They're stuck confined to this hospital ward for weeks at a time. What is it? Like, why are you so happy?" And I said, I feel like I'm getting so emotional. I get to have a baby. And that perspective changes you so much when you have never really had that opportunity before. And I felt so safe in the hospital. I was being monitored multiple times a day. The nurses were wonderful. The staff was wonderful. And yeah, were there hard times? Was I frustrated? Yeah, but I got to have a baby. And like, to me, I just had to do what I had to do. And so if I had to sit in a hospital bed, I was lucky I got to roam around a little bit. And I had plenty of visitors, which is also really special. But I got to have a baby. And I think your whole world changes when you have this history. And, it's all perspective. It really is all
Sure.
perspective. And um, I just feel so, so lucky. I still can't believe that this is my story. I
Absolutely.
really,
Absolutely.
yeah.
Absolutely. I love knowing that this is the end, that the beginning, the middle, the part of the story that is so joyful. It really is. It really is. And
Yeah.
I've had the lucky privilege of getting to meet your little one. And it's just like I said, it brings me joy just to see you two together.
Yeah.
You three together, truthfully, you and your husband together. I think
Yeah.
what I'd like to do to wrap up our conversation, because I know we can keep going, but I'm wondering if you're willing to give us two things. One, what are two misconceptions that you wish people understood about infertility? And then
Mhm.
two, I'm wondering if you could just remind the audience of the things that you found most helpful.
Okay. So in terms of misconceptions, I think the first one, which seems pretty obvious to me, but may not be that obvious to most people, is that when you have a positive pregnancy test, it doesn't mean that you're going to have a baby. And I think it's like a negative way to look at that for most people, because like you don't want to go into to getting a positive pregnancy test thinking it's not going to last. But if you are a family member or a friend of somebody going through infertility, who's had positive pregnancy tests before, just know that not having that pregnancy continue is unfortunately part of that process sometimes, and be sensitive to that. Um, I think the other one is that a family that you see isn't the product of active decision making, meaning, you could see my husband and I and my daughter and think like, why don't they have more kids? Like they should have more kids. Like, don't they want more kids? And it's not that we don't. It's just obviously, it took us a really long time to have our daughter, and who knows what's gonna be in the future. And also know what it took to get there and what it took to have her. It's not a simple thing. And I think these are like simple misconceptions, but I think
They're big ones. They're big.
and they're often things that people just choose not to think about,
Yeah.
um, but need to be considered, especially in the Jewish community where, a big family is something that's like highly um, valued. But also, it's okay to have a small family, and that is also fine. And I think that's also something that I'm seeing with a lot of my friends who are going through infertility, is that the narrative's changing a little bit, and um, only having two kids is now what a blessing, you know? Um, because honestly, like again, I don't know what's gonna be with our family. And I always thought I'd have three or four kids, but one kid is such a blessing, you know?
Absolutely.
So those are the misconceptions. In terms of what was helpful, I think you know what I'm gonna say.
Hmm.
Um, it took me a very long time to seek support outside of just general therapy for myself. But finding others who are in a similar situation to you, and finding others who have been in a similar situation to you and can help guide you, is invaluable. And the way that I found that was through a support group. There are many Jewish organizations that have support groups. Yesh Tikva was one that I went to, and I benefited from so much, and made lifelong friends from, who I'm still in touch with. Um, and being part of that group really, really helped me feel understood in a way that nobody else could really ever understand. Even my own husband, who I love and adore, and who is by my side, he wasn't the one physically going through the process, and he wasn't invested in the process in the same way,
Sure.
you know? And so meeting other women who were putting through their bodies through the same things, who have had several losses, or who could not have children biologically, but were trying to adopt, but also had that long journey, even a lot of us, like even our journeys were somewhat different, but the longing and the being part of a community outside of the Jewish community, meaning like we were all part of the Jewish community, but we all felt like fringe kind of,
Yeah.
because we didn't have children. And kind of just being able to speak to each other and support each other that way was tremendous.
Yeah.
Um, I also recommend, if you can get your spouse to go to therapy with you, that's probably really helpful. Mine was not so into that. Very supportive of my own therapy. But we talked a lot, and I'm a very communicative person and a very direct person. So um, we would have conversations all the time, just check-ins. And um, if I was sad, I would just say, I need you to be here with me. I'm depressed. Help me through today. Tell me XYZ. You can tell your spouse exactly what you want them to say and that you need to hear. And I think there's nothing wrong with that. I think that's actually a
Smart.
part of a
You just call
mature
it smart.
relationship.
Yes.
Yeah.
Just call it smart.
So
Exactly. Exactly.
yeah.
We didn't get to talk about, marriage or relationships. We'll have to say that for another time. I think though that you touched on that point of, this is happening to both of you and also each of you in your own way. And the
Hmm.
support you may need from each other is going to be different than what you need for yourself. And kind of
Right.
figuring out what it is that would be the most helpful, and asking for it and asking for that support. And I know that in some ways I feel like it sounds simple, but sometimes people need to be reminded. I do want to clarify that I am not your therapist because that would be a very
No.
deep conflict of interest.
Yes.
Make sure nobody thinks that. So just, but I do think therapy also, having your own space that you can come in, especially people say to me, "What do you want me to talk about? Like, what's there to say?" The same thing is week in, week out. And I think that therapy can be that space where I liken it to a deflating of a balloon. Like you let the air out of the balloon, and then it fills back up with the intensity over the week, and then you can just like let the balloon deflate, kind of dumping it on our shoulders or into the space of the room can be helpful for someone who's struggling with something that is an enduring difficulty. It's not like a one-time event. It's enduring. And I think that it takes a lot of
Mhm.
courage. It takes a lot of courage to keep going, and it takes a lot of courage to talk about it. And I'm very appreciative of you being willing to do both. So thank you.
Yeah, I just hope, my story can bring hope to others, in whatever way that they need it. And I wanna be the support system to those in it and, be that person who's been through it and can help guide others. I feel like that's my calling right now. And, if you wanna get in touch, you can speak to Devora and we'll get in touch.
Happy to
Happy
connect you.
to help anyone that needs me.
Thank you so much, Malka. Thank you. Thank you. Thank you.
Thanks for having me.